peaceful space where we'll explore together how to choose a moisturizer that truly serves your skin. There's no rush, no pressure, just gentle guidance as we navigate this essential aspect of skincare. Moisturizer is perhaps the most important product in your skincare routine. It doesn't matter if you have dry skin, oily skin, or anything in between. Every skin type needs and benefits from proper moisturization. Yet choosing the right moisturizer can feel overwhelming when you're faced with endless options, conflicting advice, and marketing claims that promise miracles. Let's start by understanding what moisturizer actually does and why your skin needs it. Your skin is constantly losing water through a process called transepidermal water loss. Water evaporates from the deeper layers of your skin through the outer layer and into the environment. This is a natural, unavoidable process, but when you lose too much water, your skin becomes dehydrated, compromised, and unable to function optimally. A good moisturizer does two essential things. It delivers hydration to your skin, and it helps prevent water loss by creating a protective barrier. Think of it as both giving your skin a drink and putting a lid on the glass so the water doesn't evaporate away. Now let's talk about the three main types of ingredients in moisturizers and how understanding these will help you choose the right product. First, we have humectants. Humectants are ingredients that attract water. They draw moisture from the environment and from the deeper layers of your skin to the surface. Common humectants include hyaluronic acid, glycerin, and aloe vera. These ingredients are wonderful for adding hydration, for making your skin feel plump and supple. If your skin feels tight or rough, humectants can help tremendously. Second, we have emollients. Emollients fill in the spaces between skin cells, smoothing the surface of your skin and making it soft to the touch. They help repair your skin's barrier and make your skin feel comfortable. Ingredients like ceramides, squalane, and various plant oils are emollients. If your skin feels rough or flaky, emollients will help create that smooth, soft feeling you're looking for. Third, we have occlusives. Occlusives create a physical barrier on top of your skin that prevents water from evaporating. They're like that lid we mentioned earlier, sealing in all the hydration. Ingredients like petrolatum, mineral oil, and dimethicone are occlusives. They're especially helpful if your skin is very dry or if you live in a harsh climate. The best moisturizers contain a combination of all three types of ingredients. They hydrate with humectants, smooth with emollients, and seal with occlusives. This comprehensive approach addresses all aspects of moisture maintenance. Now, how do you choose the right moisturizer for your specific skin type? Let's go through each type slowly and thoughtfully. If you have dry skin, you need a richer moisturizer with more emollients and occlusives. Look for creams rather than lotions. Creams have a higher oil content and provide more intensive moisture. Your dry skin is telling you it needs more help maintaining its barrier and holding on to water. Ingredients like shea butter, ceramides, and hyaluronic acid will be your friends. Don't be afraid of products that feel rich and substantial. Your skin needs that extra nourishment. If you have oily skin, you might think you don't need moisturizer, but you absolutely do. Oily skin can still be dehydrated. In fact, sometimes your skin produces more oil because it's trying to compensate for dehydration. Choose a lightweight, gel-based, or water-based moisturizer. These formulas provide hydration without adding excess oil. Look for non-comedogenic products that won't clog your pores. Ingredients like hyaluronic acid and niacinamide work beautifully for oily skin. If you have combination skin, oily in some areas and dry in others, you have two options. You can use one balanced moisturizer all over your face, choosing a medium weight lotion that's not too heavy and not too light. Or you can use two different moisturizers, applying a lighter one to your oily zones and a richer one to your dry areas. Listen to what your skin needs and be willing to adjust seasonally. If you have sensitive skin, simplicity is key. Choose a moisturizer with minimal ingredients and no fragrance. Fragrance is one of the most common causes of irritation and allergic reactions. Look for products labeled as hypoallergenic and designed for sensitive skin. Ingredients like colloidal oatmeal, allantoin, and Centella asiatica can be particularly soothing. When trying a new moisturizer, always patch test it first on a small area of skin to make sure it doesn't cause irritation. Let's talk about texture for a moment because the way a moisturizer feels matters tremendously. You need to enjoy using your moisturizer, or you won't use it consistently. Some people love thick, rich creams that feel nourishing and substantial. Others prefer lightweight gels that absorb quickly and leave no residue. Neither is better. It's about what works for you and what you'll actually use every day. When you're testing a moisturizer, pay attention to how it feels immediately after application and then how your skin feels an hour later. Does it sink in nicely or does it sit on the surface? Does your skin feel comfortable and balanced, or does it feel tight, greasy, or irritated? Your skin will tell you if a product is right. Trust those signals. Consider the time of day as well. Many people benefit from using different moisturizers in the morning versus at night. Morning moisturizers are often lighter because you'll be applying makeup or sunscreen over them. Night moisturizers can be richer and more intensive because your skin does most of its repair work while you sleep, and you don't need to worry about makeup application. Speaking of sunscreen, if your moisturizer contains SPF, that's wonderful for morning use. But remember that you need to apply enough to get the stated protection, about a quarter teaspoon for your face. Many people don't apply enough moisturizer to achieve adequate sun protection. So you might consider using a separate sunscreen to ensure you're fully protected. Let's address price for a moment. Expensive doesn't always mean better. Some of the most effective moisturizers are quite affordable. What matters is the ingredient list and how the product works for your specific skin. Don't feel pressured to spend a fortune. A drugstore moisturizer with good ingredients can work just as well as a luxury product. However, if a higher-end product brings you joy, if applying it feels like a special ritual that you look forward to, and if it works well for your skin, then it's worth the investment. Skincare should feel good. It should be something you enjoy, not endure. When reading ingredient lists, remember that ingredients are listed in descending order by concentration. The first 5 to 7 ingredients make up the bulk of the formula. This is where you want to see your key moisturizing ingredients, your humectants, emollients, and occlusives. Be cautious of products that list water as the first ingredient, followed by many fillers before you get to any beneficial ingredients. While water is a necessary base for most moisturizers, you want to see nourishing ingredients high up on that list. One more consideration: seasonal changes. Your skin's needs vary with the weather and climate. You might need a lighter moisturizer in humid summer months and a richer one in dry winter weather. This doesn't mean you need to buy multiple products at once. Start with one good moisturizer for your current season and adjust as needed when the weather changes. How do you apply moisturizer for maximum benefit? Always apply it to damp skin. After cleansing, gently pat your face with a towel, leaving it slightly damp, then immediately apply your moisturizer. This helps lock in that extra water and makes your moisturizer more effective. The humectants in your moisturizer will draw that water deeper into your skin. Use gentle upward strokes when applying. Take your time. Use this as a moment of self-massage and care. Press the product gently into your skin rather than rubbing vigorously. Be especially gentle around your delicate eye area. Don't forget your neck and décolletage. The skin there is just as deserving of moisture and care as your face. Many people focus solely on their face and then wonder why their neck shows signs of aging. Extend your moisturizer down your neck in upward strokes. What if you try a moisturizer and it doesn't work for you? That's okay. Skincare is personal, and what works wonderfully for someone else might not work for you. Don't feel discouraged. Simply make note of what you didn't like about it and use that information to guide your next choice. Was it too heavy? Too light? Did it cause any irritation? Each product teaches you more about what your skin needs. As we come to the close of our time together, remember these key points. Every skin type needs moisturizer. Choose based on your skin type and personal preferences. Look for products with humectants, emollients, and occlusives. Apply to damp skin for best results. Be willing to adjust seasonally. And most importantly, choose a moisturizer you actually enjoy using. Your moisturizer is your skin's daily drink of water, its protective barrier against the environment, its nourishment and support. Choose thoughtfully, but don't overthink it. Your perfect moisturizer is out there, and you'll know it when you find it because your skin will feel comfortable, balanced, and cared for. Take a deep breath in and release. You now have the knowledge you need to choose a moisturizer that serves your skin beautifully. May your skin feel hydrated, comfortable, and healthy. May you find joy in caring for it. Thank you for this peaceful time together. Be well and be gentle.
Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 65: Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66: Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk, oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided though new evidence suggests safety. Potentially safe during pregnancy: topical salicylic acid used in small amounts and limited areas, large-scale systemic absorption possible though typically minimal, topical azelaic acid, generally considered safe, topical clindamycin, some. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, hormone therapy and transition-related acne. Transgender and non-binary alongside other health concerns. Chronic illness causes stress, sleep disruption, and immune dysfunction, all acne worsening factors. Flares of underlying chronic conditions often coincide with acne worsening. Medications for chronic illnesses sometimes interact with acne treatments, requiring careful coordination. Energy limitations from chronic illness might make complex skincare routines unsustainable. Simplified routines are sometimes necessary. During chronic illness flares, simplifying skincare to basic cleanse protect routines is appropriate. During periods of better health, more comprehensive acne treatment is possible. Mental health in chronic illness overlaps with acne's psychological burden. Both require professional support. Healthcare provider coordination between specialists treating chronic illness and dermatology ensures appropriate care. Prioritizing which health concerns to focus on during periods of limited energy helps. Sometimes managing underlying chronic illness takes priority over aggressive acne treatment. Guide 91, Acne Treatment and Vaccination, timing and considerations. Concerns sometimes arise about acne medication interactions with vaccines or vaccine effects on acne. Most acne treatments don't interact meaningfully with vaccines. Topical treatments have minimal systemic absorption and don't affect vaccines. Oral antibiotics for acne don't affect vaccine efficacy. Vaccines should be given as scheduled regardless of antibiotic use. Isotretinoin doesn't interact with vaccines, though the immune system suppression during severe acne might theoretically reduce vaccine efficacy. Live vaccines are contraindicated during isotretinoin use due to theoretical immunosuppression risks, though actual risks are minimal. Some vaccines might cause temporary acne flares through immune system activation. This is temporary and doesn't indicate vaccine problems. Vaccines don't cause persistent acne. Any acne appearing after vaccination is likely coincidental timing rather than vaccine-related. COVID-19 vaccines have not been shown to affect acne or interact with acne treatments. Timing vaccines around acne treatment is generally unnecessary. Vaccinations and acne treatment can proceed on standard schedules without coordination. Guide 92, Acne Prevention in High-Risk Children and Adolescents. Children with strong family history of severe acne are at high risk for developing severe acne. Early prevention strategies might prevent progression to severe acne requiring aggressive treatment. Starting gentle skin care routines early, non-comedogenic cleansing, sun protection, gentle moisturizing, establishes good habits before acne develops. Education about acne prevention helps young people understand triggers and prevention even before acne appears. Stress management skills learned early help reduce stress-related acne worsening later. Healthy diet and sleep habits established in childhood support skin health throughout life. Early intervention at first signs of acne prevents progression. Some dermatologists recommend seeing high-risk children early for preventive guidance. Avoiding triggers identified through family acne patterns, particular foods, products, environmental factors, might prevent acne development. Psychological preparation for potential acne, normalizing that acne is common, reducing stigma, helps adolescents manage it psychologically if acne develops. Guide 93, Acne in Performing Arts and Image-Dependent Professions. Performers and those in image-dependent professions, models, actors, social media influencers, experience unique acne-related pressures warranting specialized management. Career-threatening pressure intensifies acne's psychological impact. A small breakout affecting someone's livelihood differs from same breakout's impact on others. Professional makeup demands acne coverage requiring heavy makeup potentially triggering acne cosmetica. Using non-comedogenic makeup and proper removal helps minimize this. Professional headshots and promotional photos emphasize clear skin. Acne interferes with professional image management. Scheduling professional appearances around acne cycles when possible helps. If acne is cyclical, scheduling performances during clear phases. Professional dermatology involvement is often valuable for ensuring consistently clear skin during critical professional periods. Some performers use preventive acne treatment intensification before important performances, temporarily increasing treatment frequency. Mental health support helps manage the intensified appearance pressure these professions create. Guide 94, Acne and Sleep Disorders, Managing Acne while Managing Sleep Issues. Sleep disorders, insomnia, sleep apnea, restless leg syndrome, create multiple acne worsening factors, making acne management more challenging. Sleep deprivation from any sleep disorder worsens acne through stress hormone, immune, and inflammatory mechanisms. Sleep medications sometimes worsen acne. Discussing with sleep specialists whether acne worsening might relate to sleep medications is appropriate. Treating underlying sleep disorders often improves acne significantly through improved sleep quality and stress reduction. Managing both sleep and acne requires comprehensive approach addressing both conditions. CPAP machines and other sleep disorder treatments might trigger acne through skin irritation. Using protective barriers and keeping equipment clean helps. Guide 95, Acne and Fertility, Female and Male Considerations. Acne treatments have fertility implications requiring consideration for those planning pregnancy or concerned about fertility. Isotretinoin is highly teratogenic and absolutely contraindicated in pregnancy. Women of childbearing age must use reliable contraception while on isotretinoin. Spironolactone might affect male fetus development. Stopping spironolactone while planning pregnancy or if pregnancy occurs is generally recommended. Birth control pills used for hormonal acne obviously affect fertility planning. Stopping pills when planning pregnancy allows pregnancy attempt. Other acne treatments don't significantly affect fertility and can be continued during fertility attempts. Male fertility is theoretically affected by anabolic steroids, which cause severe acne, through testosterone suppression effects, though acne treatment itself doesn't affect male fertility. Untreated severe acne might indirectly affect fertility through mental health impacts and reduced relationship satisfaction. Treating acne supports fertility planning outcomes. Guide 96, Acne and Alcohol Use, Interactions and Effects. Alcohol affects acne through multiple mechanisms. Understanding these relationships helps you make informed alcohol decisions. Alcohol increases inflammation and dehydration, both worsening acne. Excessive alcohol consumption notably worsens acne in most people. Alcohol consumption patterns matter. Occasional moderate alcohol probably has minimal skin effects. Chronic excessive consumption significantly worsens acne. Some acne medications interact with alcohol. Isotretinoin with alcohol increases liver toxicity risk. Antibiotics with alcohol sometimes cause nausea and reduced effectiveness. Alcohol increases cortisol and stress, indirectly worsening acne through hormonal pathways. Alcohol disrupts sleep quality, indirectly worsening acne through sleep deprivation effects. Dehydration from alcohol increases skin dehydration, contributing to compensatory sebum production and acne. For optimal acne management, minimizing alcohol consumption is beneficial. This doesn't require complete abstinence for most people, but reducing consumption supports acne improvement. Guide 97, Acne and Smoking, Direct and Indirect Effects on Skin. Smoking worsens acne through multiple mechanisms, making smoking cessation valuable for acne improvement. Smoking increases inflammation systemically, promoting acne. Smokers have higher acne prevalence than non-smokers. Smoking impairs immune function, reducing your body's ability to fight acne-causing bacteria. Smoking impairs wound healing, increasing scarring risk from acne lesions. Smoking damages skin barrier function, increasing irritation and acne risk. Secondhand smoke exposure, while less harmful than direct smoking, also worsens acne through similar mechanisms. Smoking interferes with many acne medications. Some medications have reduced effectiveness in smokers. Smoking accelerates skin aging, creating double damage, worse acne plus premature aging. Smoking cessation, beyond its general health benefits, often improves acne significantly. Many former smokers notice acne improvement within weeks to months of quitting. For optimal acne management, smoking cessation is highly beneficial if applicable. Conclusion: your acne treatment journey. Congratulations on completing this comprehensive 100 guide